The three main categories for diuretics are thiazide and thiazide-like diuretics, loop diuretics, and potassium-sparing diuretics. A diuretic is a drug that decreases fluid volume by increasing urine output. Although their site of action is the kidney, diuretics are chiefly used for cardiovascular problems, such as high blood pressure, known as hypertension, and heart failure, rather than for kidney problems. Diuretics typically work well, are safe, and well tolerated by the patient, and are cost-effective. Diuretics are usually classified into three groups: thiazides, chlorothiazide, and hydrochlorothiazide, and thiazide-like diuretics such as metolazone, indapamide, and loop diuretics known as furosemide and bumetanide, and potassium-sparing diuretics such as amiloride, triamterene, and spironolactone. The most effective diuretics are those that work at the ascending loop of Henle in the nephron. Water always follows sodium. Diuretics that work by increasing sodium excretion in the urine always increase the water in the urine output. Thiazide diuretics is a classification. The diuretics clear excess fluid from body for decreased peripheral vascular resistance. Most common class of diuretics, and decreases sodium and chloride reabsorbed by kidneys. Some examples of this drug classification is hydrochlorothiazide, also known as hydrodiureal, and chlorothiazide, known as diureal. If you notice that the common ending to these drugs are thiazide, hence this is the thiazide diuretic classification. Thiazides and thiazide-like diuretics work at the end of the ascending loop of Henle and the beginning of the distal convoluted tubule in the nephron. This class of drugs increase urine output by preventing water, sodium, potassium, and chloride from being reabsorbed into the blood through the walls of the nephron. As a result, the water and electrolytes stay within the tubules, making their way through the renal system into the bladder and then are excreted from the body. Thiazide and thiazide-like drugs are the most commonly used type of diuretic and often are first-line agents in the management of high blood pressure. Over the long term, thiazides also dilate the smooth muscles in the arterioles, the smallest vessels in the arterial system. The heart does not have to work as hard to pump blood into the vascular system because the arterioles are dilated. Healthcare provides prescribed diuretics for a variety of conditions, including high blood pressure, heart failure, and cirrhosis of the liver. They are typically used in conditions that require a decrease in edema. Diuretics can sometimes increase the excretion of other drugs in cases of an overdose. The nursing implications for thiazide diuretic medications would be to weigh the patient daily while he or she is taking diuretics to monitor the trends and prevent dehydration. In the acute care setting, monitor intake and output to make sure that the patient achieves fluid balance. Monitor the potassium levels to assess that they are within normal levels because these drugs reduce the blood potassium levels. Monitor the patient's basic metabolic panel, known as the BMP, to check for abnormal electrolytes, the BUN, and the creatinine. These laboratory tests can indicate fluid electrolyte imbalance or kidney problems. Report below normal potassium levels to the healthcare provider because low potassium levels can have serious effects on muscles and breathing. Inform the healthcare provider if your patient has a history of gout because thiazide diuretics can cause a flare-up. If the patient has diabetes, monitor his or her glucose level carefully because diuretics can cause elevated blood sugar. Hold diuretics if patients have a blood pressure lower than 90/60. This is what the book says, but the parameters are truly 100/60 unless they are specifically outlined by a physician's order, a different number, because this can be a symptom of dehydration or other adverse effect. Assess the patient for changes in vital signs, particularly a decrease in the blood pressure. Carefully assess the patient for any signs of dehydration before giving any diuretic. Monitor daily weight for changes from a baseline weight from the patient's normal weight. If the patient's weight is below his or her normal weight, contact the healthcare provider before giving the diuretic. Check the patient's most recent potassium level. If the level is below the normal range, which can be caused by thiazide or loop diuretics, or above the normal range, which can be caused by potassium-sparing diuretics, contact the healthcare provider before you give or administer the drug. Planning and implementation of giving diuretics in the morning to avoid disturbing the patient's sleep at night. Tell patients that they will most likely experience urinary frequency and urgency and therefore should be near a bathroom or have access to a urinal or bedside commode after taking the drug. Make sure patients know to ask for help when getting up if needed. Tell patients to notify you if they have any weakness, muscle cramping, numbness, or tingling in the extremities, or sensation of irregular heartbeat because these may be symptoms of a decreased potassium level. Continue to monitor trends in daily weight, peripheral edema, and blood pressure while the patient is taking diuretics. For thiazides and loop diuretics, teach patients to eat foods that are high in potassium. For potassium-sparing diuretics, teach patients to avoid foods that are high in potassium. Some expected side effects and adverse effects of thiazide diuretics are increased risk of increasing uric acid levels, contributing to a gout flare, especially if there is an underlying history of gout. Dry mouth, urgency, frequency, increased urinary output, electrolyte imbalance, postural hypotension, lightheadedness, hypokalemia, dehydration, cardiac dysrhythmia, an increased risk for hypokalemia with use of corticosteroids and antibiotic conjunction therapy. Common side effects of diuretics include urinary urgency and frequency. Other expected side effects include dry mouth, increased thirst, and lightheadedness. Fluid and electrolyte imbalances are common side effects. Thiazide diuretics can cause an increase in uric acid, which can cause flare-ups of gout in certain patients. Diuretics increase urinary output. As a result, dehydration is a major adverse effect. The signs and symptoms of dehydration include increased heart rate, low blood pressure, decreased urinary output or dark yellow urine, dry mouth with a sticky coating on the tongue, and tenting of the chest or the forehead. If you pinch the skin remains elevated like a tent when you release it. Thiazides and loop diuretics can cause severe hypokalemia, which is low potassium, whereas potassium-sparing diuretics can cause the opposite, hyperkalemia. Signs of hypokalemia include muscle cramping, abnormal heart rhythm, and changes in reflexes. Signs of hyperkalemia include confusion, irregular heart rate, numbness of the hands or feet, and feeling of heaviness in the legs. Loss of sodium can cause confusion, irritability, fatigue, and even seizures in some patients. A major adverse effect of all diuretics is severe low blood pressure that can result in falls, particularly in high-risk and older patients. The drug-to-drug interactions, increased loss of potassium, can result from the use of a thiazide or loop diuretic if the patient is taking a corticosteroid or certain antibiotics. For patients with bipolar illness using lithium, the loss of sodium caused by diuretics can increase the risk for lithium toxicity. The expected evaluation or desired outcome for thiazide diuretic medications are that a decrease in the blood pressure would be obtained, there would be an increase in urinary output, and there would also be a decrease in peripheral edema. Over the long term, thiazides are also dilating the smooth muscles in the arterioles, the smallest vessels in the arterial system. The heart does not have to work as hard to pump blood into the vascular system because the arterioles are dilated. A loop diuretic, the most potent diuretic, act on loop of Henle to inhibit sodium and chloride reabsorption. The loop and thiazide diuretics cause loss of valuable potassium, and they may require supplemental potassium. An example of a loop diuretic is furosemide, known as Lasix, and bumetanide, known as Bumax. A loop diuretic is a drug that increases urine output by blocking active transport of chloride, sodium, and potassium in the thick ascending loop of Henle. Loop diuretics, also known as high-ceiling diuretics, are widely considered the most powerful of the diuretics. Use can result in significant decrease in fluid volume and increase in urinary output. The loop diuretics are used in a variety of conditions, including heart failure, pulmonary edema, and cirrhosis of the liver with ascites. Potassium is one of the major electrolytes that can be lost after loop diuretic administration. Monitor the potassium levels carefully because significant changes in potassium can result in cardiac dysrhythmias. Foods with high or very high potassium levels are fruits such as apricots that are canned, oranges, orange juice, fresh peaches, bananas, mangoes, dried fruits, and prune juice have even a higher concentration of potassium. Some vegetables that contain some high contents of potassium are asparagus, fresh or cooked beets, Brussels sprouts, and okra. Some other vegetables that even contain higher amounts of potassium are beets, black beans, potatoes with the skins, baby carrots, and sweet potatoes. Some other miscellaneous foods would be peanut butter, nuts and seeds, chocolate, and salmon, even the canned salmon. Bouillon, the low-sodium bouillon cubes, milk, and chocolate. Pizza, if you have at least 2 slices. Salt substitute, yogurt, milkshake, and treat yourself to a cappuccino. Side effects are more severe with loop diuretics than other diuretics because drugs in this class are the most powerful diuretics. Watch for symptoms of low potassium, including dry mouth, increased thirst, muscle cramps, fatigue, weakness, and mood changes, because low potassium levels can have serious effects on muscles and breathing. Report potassium levels lower than 3.5 MEq per liter. to the healthcare provider because low potassium levels can have serious effects on heart rhythm. Remind patients to stand up slowly to avoid orthostatic hypotension. Notify the healthcare provider if the patient reports decreased hearing or a ringing in the ears, because loop diuretics can be ototoxic, which is damaging to the hearing. Discontinuing the drug typically reverses the changes in hearing. Monitor the blood glucose in patients with diabetes because these drugs can also cause hyperglycemia. Check and record urine output to make sure the drug is working properly. You may need to empty the Foley catheter more frequently. Urination typically occurs within 1 hour, so inform the patient that he or she will need to be close to a bathroom to avoid urinary urgency or incontinence. Some adverse effects about the diuretics in this class are increased urinary output, and as a result, dehydration is a major adverse effect. The signs and symptoms of dehydration include increased heart rate and low blood pressure, decreased urinary output, and dark yellow urine, a dry mouth with a sticky coating on the tongue, and tenting of the chest or the forehead when you pinch the skin, and the skin remains elevated like a tent when you release it. Thiazides and loop diuretics can cause severe hypokalemia, which is low potassium level. Signs of hypokalemia include muscle cramping, abnormal heart rhythm, and changes in the reflexes. Loss of sodium can cause confusion, irritability, fatigue, and even seizures in some patients. A major adverse effect of all diuretics is severe low blood pressure, and it can result in falls, particularly in high risk and older patients. The drug interactions, increased loss of potassium, can result in the use of thiazide and loop diuretics. If patients are taking corticosteroids or certain antibiotics, for patients with bipolar illness, using lithium, the loss of sodium caused by diuretics can increase the risk for lithium toxicity. Some expected side effects or common side effects of diuretics include urinary urgency and frequency. Other expected side effects include dry mouth, increased thirst, and lightheadedness. The expected evaluation or desired outcomes for loop diuretic medications is a decrease in edema, decrease in abdominal girth and weight, an increase in urinary output, and a decrease in blood pressure. Another class of diuretics is potassium-sparing diuretic. Its action is that it interrupts the sodium-potassium exchange in the distal tubule, sparing potassium loss. Examples of this drug is spironolactone, known as aldactone, amiloride, known as mitamor, and triamterene, known as direnium. A potassium-sparing diuretic is a drug that increases the excretion of water and sodium, leading to increased urine output without the loss of potassium in the urine. They are called potassium-sparing drugs because they do not waste potassium, which often occurs with thiazide and loop diuretics. Potassium-sparing diuretics act by slowing the sodium pump in the collecting duct of the nephron so that more sodium and water are excreted as urine. The nursing implications for potassium-sparing diuretics is to monitor the potassium levels to assess whether they are within the normal levels, because higher than normal blood potassium levels can occur with these drugs. Report potassium levels greater than 5.0 MEQs per liter. to the healthcare provider because high potassium levels can cause dangerous cardiac problems. Teach patients the signs of a high potassium level, including confusion, irregular heartbeat, nervousness, numbness, or tingling in the hands or feet, unusual fatigue, and a heavy feeling in the legs. Teach patients to stand up slowly to avoid orthostatic hypotension because these drugs decrease fluid volume and decrease blood pressure. Teach patients to avoid foods high in potassium to prevent hyperkalemia. Remind patients to avoid salt substitutes because they are often high in potassium. The patient and family teaching for potassium-sparing diuretics. Take the drug exactly as it is prescribed. Teach the patient not to skip or double up on doses. Doses are best taken early in the day to avoid affecting sleep at night. If you are taking a thiazide or a loop diuretic, include several high potassium foods in your diet every day. If you are taking a potassium-sparing diuretic, avoid foods high in potassium and salt substitutes which may be high in potassium. Use sunscreen and protective clothing to avoid skin irritation and sunburn because of photosensitivity. Report any signs of abnormal potassium levels such as muscle cramping, weakness, numbness or tingling in the extremities, or sensation of irregular heartbeat to your healthcare provider. It will be helpful to monitor daily weight if there is any change in fluid levels above or below your normal weight. Notify your healthcare provider if you experience any unintentional weight loss or weight gain. If you are taking a diuretic for your blood pressure, remember that high blood pressure is not cured by drugs, and you should not stop taking the drug without consulting a healthcare provider. Avoid taking any over-the-counter drugs without discussing this with your healthcare provider to avoid a drug interaction. Potassium-sparing diuretics with angiotensin-converting enzyme inhibitors, ACE, or angiotensin receptor blockers, ARBs, can lead to hyperkalemia. Patients taking potassium-sparing diuretics should avoid salt substitutes to decrease the risk of hyperkalemia. The expected side effects and adverse reactions of potassium-sparing diuretics. The common side effects of diuretics include urinary urgency and frequency. Other expected side effects include a dry mouth, increased thirst, and lightheadedness. Fluid and electrolyte imbalances are common side effects. With potassium-sparing diuretics, the electrolyte side effect is hyperkalemia. The adverse effects: diuretics increase urine output, and as a result, dehydration is a major adverse effect. Signs and symptoms of dehydration include increased heart rate, blood pressure, increased urinary output, or dark yellow urine, dry mouth with a sticky coating on the tongue, and tenting of the chest or the forehead when you pinch the skin. The skin remains elevated like a tent when you release it. Signs of hyperkalemia include confusion, irregular heartbeat, numbness of the hands or feet, and a feeling of heaviness in the legs. Loss of sodium can cause confusion, irritability, fatigue, and even seizures in some patients. A major effect of all these diuretics is severe low blood pressure that can result in falls, particularly in high risk and older patients. The drug-to-drug interactions with potassium-sparing diuretics with angiotensin-converting enzyme inhibitors or angiotensin receptor blockers can lead to hyperkalemia. Patients taking potassium-sparing diuretics should avoid salt substitutes to decrease the risk of hyperkalemia. The expected evaluation or desired outcome for potassium-sparing diuretics is increase in diuresis and decrease in edema while maintaining serum potassium level in an acceptable range, decrease in blood pressure, prevention of hyperkalemia in patients taking diuretics, and treatment of hyperaldosteronism. When patients are prescribed a loop diuretic, it's best to look at the patient's laboratory reports to see what that potassium baseline is before starting a loop diuretic to make sure that the patient is in the parameters. If the patient is in the low range parameter of a normal potassium level, it may be in the best interest for the patient to ask the physician for a potassium supplement to be ordered along with that loop diuretic. The physician may give a low dose. These medications start out with a dose of 10 MEQs. They can go up as high as 40 to 60 MEQs, BID, TID, depending on the severity of the hypokalemia. K-Dur and your micro K or any of your potassiums are not intended to be crushed. If it is a tablet, its microbeads compressed together to make a tablet. You can put it in a little bit of water and it will break loose into the microbeads, and then you can put that into applesauce, or you can mix that in with some more water and put it down a G-tube. But you're not to crush it because those are microbeads of extended release. You'll destroy the properties, or you will create an immediate release of the potassium. And if your patient has a liquid potassium to drink, it is very sharp tasting. It almost takes your breath away. It definitely needs to be disguised or mixed into some flavored juice.